Welcome back. I'm Nadine the Gluten Free RN, and today on the Gluten Free RN podcast, episode 33, we're going to review 21 important celiac disease facts you need to know. And this comes directly from Gluten Free Works, which we'll talk about. Stay tuned. Hi, this is Nadine, the Gluten Free RN, and today during episode 33, we're going to review 21 important celiac disease facts you need to know. And as usual, I have posted all of the references on the podcast notes, so please refer to those. And you can print yourself off a copy of these 21 important celiac disease facts that you need to know right from the podcast notes. But first, I'd like to mention that I've noted that we have listeners in Zimbabwe, Italy, New Zealand, Republic of Korea, the Russian Federation, and Jordan. So welcome to all of the listeners out there worldwide who are hopefully getting valuable information from listening to the Gluten Free RN podcast. It's my pleasure to bring you not the usual information, I hope, but the useful information and the information you may or may not be getting from other sources. And what I mean by that is even this week, I had a very bright, beautiful, very athletic 21-year-old who had been diagnosed with celiac disease 2 years ago, and no one in that period of time had done follow-up for her, had gone over her test results, so she actually knew what her numbers were, and she had not been referred to anyone to follow her case. So her and her family have pretty much been learning things on the websites, which, as we all know, that information may be accurate, but it may not be also, and it's very confusing to determine which is which. So when I found out that this 21-year-old had not ever gone over her lab work, during her consultation with me, we went over her lab work and you could just see the light bulb go on as far as understanding what her numbers were, her elevated numbers for the celiac antibody panel. She began to understand how serious that celiac disease was and was much more receptive to the information that I was giving her. So I encourage everyone to please find a practitioner or somebody that understands about celiac disease and non-celiac gluten sensitivity and can give you the right information and certainly can help everyone with the follow-up. Because it's not just a single person, it's the entire family. And not only that, there's very rarely ever just one celiac in a family. Once you find one celiac, you will find more. And just because a family member does not have celiac disease at the given time of testing, it does not mean they won't develop celiac disease over time. So let's get back to the 21 important celiac facts you need to know. And this was posted by John Libinati. His mother, Clea Libinati, wrote, recognizing celiac disease way back in 2007. Recognizing celiac disease is a very important reference material for any healthcare provider to have. At this point, it is a little dated. Recognizing celiac disease, signs and symptoms, associated disorders, and complications does point out that there is over 300 associated signs and symptoms that are either mis- or undiagnosed celiac disease and can be associated with celiac disease proper. So it is very important for healthcare providers to understand this information so that they can recognize patients. Number 1 on the 21 important celiac disease facts that you need to know is that celiac disease is one of the most common genetic autoimmune diseases in the world. Again, it doesn't just say in the United States or Europe or Northern European people. It's actually in the world. Please take from this point that you are extremely powerful. There are a lot of people with celiac disease worldwide, and we are very powerful because we have to buy food. And the industry is paying attention to the fact that we are buying much less wheat, barley, rye, and oats, and typically less grains overall. And there are more and more gluten-free products available on the shelves. And even more importantly, grass-fed, no antibiotic, no hormone beef and meat, and also local organic produce that is not GMO. So we are very powerful, and the industry does pay attention. The food industry, the pharmaceutical industry, unfortunately, is also paying attention. So you are powerful and use your power for good. But vote with your dollars and make sure that you communicate very clearly about what you will and will not pay for. Number 2, celiac disease is the most commonly misdiagnosed disease in the world. What that means is that many other things get diagnosed instead of celiac disease. But once celiac disease is diagnosed and people are put on the appropriate diet, whether that's a gluten-free, dairy-free, soy-free, or some variation of a paleo or whole food diet, then people get better, which is what I, as a nurse, very much like. And I'm sure Cleo Limonati, as a nurse, loves that also. But we do have to be recognized as celiac before we can adopt a gluten-free diet, or we at least have to hear those words before we can use our critical thinking skills and see if that is perhaps an option for us to try as a clinical experiment or to get tested. Which brings us to point 3. Celiac disease blood tests are not pass-fail. They measure antibody levels that suggest how likely an intestinal biopsy will discover damage consistent with celiac disease, which means that even if you have a negative blood test, it doesn't mean you don't have intestinal damage. Frequently, the blood test will only pick up damage when you have a Marsh 3 or Marsh 4 damage to your villi, or you have villus atrophy. And those numbers aren't always suggestive of how much damage is done. The other important part I want you to recognize is that 70% of these blood tests or the antibody tests are false negative nationwide. So they're not very good, despite the high marks they get for sensitivity and specificity. It should be noted that if you do have a positive anti-tissue transglutaminase 2 and a positive EMA or endomyocele antibody, then you have gut damage somewhere. So you get to decide whether you have a confirming biopsy or not. Because if those two parts of your antibody test are positive, then you have intestinal damage. 4. Celiac disease can affect any genetically predisposed person of every race or gender and can first present symptoms at any age. So nobody can be ruled out, especially if you are a carrier of the HLA-DQ2 and or DQ8 genes. People get diagnosed at any age, and we have to be hypervigilant for the people over the age of 60, because 30% of the people that are getting diagnosed at this point are over the age of 60. So these are our elderly persons, and I laugh because I'm quickly approaching that elderly age bracket, even though I'm just in my 50s and I'm quite spry at this point. And I wasn't diagnosed until I was 40, truly by accident. And my blood test was negative, my skin biopsy for DH was negative, but I had already adopted a gluten-free diet, and I got much better very quickly. And then come to find out, I'm an HLA-DQ2.5 gene carrier, also homozygous, which means I got genes from each parent, which puts me in the super celiac category, meaning that I will typically get much sicker and have a harder time healing once I am diagnosed, which, believe it or not, was true to form. But I continue to heal. I am my own experiment, and I am getting better and better every day. Some ups and downs, of course. But I'm a giant celiac experiment, and you're your own experiment. 5. Optimal treatment of celiac disease includes 1. 100% strict gluten-free diet. 2, nutrient deficiency identification and replenishment. And 3, education and support that meets the physical and emotional needs of the patient. So all of those things need to be accomplished once a person is determined to be celiac. And we do, at the very least, have to be 100% on a strict lifelong gluten-free diet. For most of us, that's not enough, and we typically have to rid our diet of other things, especially dairy, usually soy, and for some of us, we like to get rid of all of the grains and legumes and anything that's going to cause inflammation. We have to identify the nutrient deficiencies and then work with somebody to find out how to supplement, what to eat, ideally, and how to heal our bodies so that we can be the optimal human beings that we were meant to be. And then seek out education and support, which means you have to get educated and also find a gluten-free support group or attend a gluten-free conference or a paleo conference in your area. Find your people so that you can feel supported and also make sure that you are getting the right information to physically heal. 6, most cases of unresponsive celiac disease are due to an inadvertent gluten exposure where the person is consuming gluten without realizing it. I find this every day. Most of my people get better within a year or 2 or 3, but some of my people continue to have high antibody panels. And some of my people actually don't have any symptoms when they are exposed to gluten. And I don't consider that to be an advantage. So they may be consuming gluten or they may be getting cross-contaminated, but they just don't know it because they don't have any identifying symptoms. They don't get canker sores, they don't have difficulty swallowing, they don't vomit or get diarrhea or get belly pain. Really, they just don't have any outward symptoms. So for those people, I consider it a disadvantage. So I live in Oregon, and when they are harvesting the wheat, which they grow a lot of in Oregon, then a lot of people actually get asthma type symptoms or respiratory type symptoms. So you don't have to be consuming it orally into your digestive tract. You can actually be breathing it in, which, by the way, ends up in your digestive tract and in your bloodstream. So we have to be very cautious about our environment. So those people with unresponsive celiac disease or refractory celiac disease really have to have a person similar to me or somebody that is an expert in celiac disease really look at their home environment, where they live, and how to ferret out those elusive exposure to gluten possibilities so that they can get better. I've even had to tell some people to move out of where they live if they live in the middle of a wheat field because they're just not going to get better. 7, the average person with celiac disease has a normal body index. The traditional thinking was that a person with celiac disease would be underweight. And we all know that at least 33% roughly of the people that have been diagnosed with celiac disease are overweight. So it can be any body mass index or any type of body shape. So I myself am 5'9 3/4 tall. And when I got diagnosed, I weighed about 165, which was, for me, about 20 pounds overweight. So I was consider myself to be overweight when I got diagnosed. Not everybody is cachectic or losing weight or malnourished appearing. But even people that are obese are potentially malnourished or starving. It's their body's attempt to store cheap energy. So once those people get on a gluten-free diet, they lose enormous amounts of weight typically. And it's not necessarily a weight loss plan, but once their bodies get the nutrients that their body needs, then they lose all that excess weight. It can be an amazing thing to watch. 8, silent celiac disease refers to a person who tests positive on a blood test and villus atrophy on intestinal biopsy, but exhibits no overt symptoms. So we talked about this a little bit. And roughly 50% of the people that get diagnosed with celiac disease on a screening exam would say they have no symptoms. And honestly, that would have been me. I would have said, I'm perfectly healthy. There's nothing wrong with me. I have a super immune system. I've worked in the emergency departments for 17 years. I just don't get sick. Well, actually, looking back, I did get sick quite a bit, but I just worked anyway. And I would get that backache, those muscle spasms in my lower back. And I attributed that to working on concrete floors and 12-hour night shifts and lifting heavy patients. And I'd get edema in my lower extremities. And I had reasons for all those things. But the reality is I don't have any of those things anymore once I started a gluten-free diet. I no longer get debilitating muscle spasms in my lower back. But I now recognize that I had a ton of symptoms of celiac disease that an astute practitioner could have actually recognized ever since I was a child, but it was never recognized until I was 40 years old and almost dead with multi-system organ failure. So hopefully all of this information will prevent that for you or someone you love. Celiac disease presents submicroscopic damage causing nutrient deficiencies before villus atrophy. That is, before an endoscopy with biopsy finds intestinal damage, damage can already be occurring. That is very true. And what I hear stories about are patients go in to get a biopsy of their small intestines, and the doctors say, well, you don't have Marsh 4 damage. You don't have complete destruction of your villus architecture, so therefore you don't have celiac disease yet. But the reality is, even Marsh 1 damage, when the microvilli are destroyed, that's damage caused by gluten, and that is celiac disease. So we don't have to wait until we have total villus atrophy before we get diagnosed with celiac disease. So that is why it's very important to have somebody that is knowledgeable about celiac disease review all of your biopsies, your antibody screenings, any of your lab work, because there are clues there and there are ways to read it that perhaps your regular practitioner or regular gastroenterologist just aren't reading correctly. 50% of people diagnosed with celiac disease exhibit neurological symptoms at the time of diagnosis. Yes, celiac disease is primarily a neurological disorder. So if you have any neurological symptoms such as neuropathies or numbness or tingling in your hands or your feet, seizure disorders, tics, especially facial tics, Bell's palsy, vesiculations of your muscles, if you have pins and needles in your feet or gastroparesis, or even constipation is a neurological disorder. It's paralysis of your intestines. 11. Doctors consider celiac disease to be a gastrointestinal disease. Many people with neurological symptoms due to celiac disease do not exhibit gastrointestinal symptoms. These people have decreased chance of receiving a correct diagnosis. So not everybody has gastrointestinal symptoms. Some people just have skin issues. Some people just have neurological disorders. So a doctor has to be very astute, or a medical professional has to be very astute and know what all those 300 plus signs and symptoms of celiac disease can look like. That's why having a copy of Recognizing Celiac Disease is so important. 12. Anxiety can be the only symptom of celiac disease. In this case, it is due to nutrient deficiencies. Yes. How many people do you know that are just anxious or irritable or cranky? Well, believe it or not, that can be a sign or symptom of celiac disease, and it points to nutritional deficiencies. They have to be tested for, recognized, and treated appropriately. And then typically those anxiety issues go away. 13. Celiac disease tests are not pass-fail. A patient can test negative on one day and positive 2 weeks later. Follow-up testing should be performed if symptoms do not resolve. That's called seroconversion. So a person can test negative one day and positive in as little as 2 weeks later or 2 months later. It means enough damage has happened to the villi that those Antibody tests are then positive. 14. Patient education is the most important predictor of good clinical outcome in celiac disease. The more you know, the more likely you would be to avoid gluten. Develop a diet that works best for your health and lifestyle, and get well and stay healthy. So it's very important that you, again, find somebody that knows what they're talking about. Find a good celiac nutritionist, RD, RN, MD, DO, at least somebody, a naturopath, whoever you trust that actually knows what they're talking about for celiac disease. And please run away from the practitioners that tell you that they're going to cure you of celiac disease, because that's just not going to happen. Find somebody that you're comfortable with. And what I mean by that is some practitioners will take you so far, and then you get as far as they're going to be able to take you, then go find a different practitioner or work with massage therapists or acupuncturists, people that are going to do some body work on you to repair some of the damage that's been done and help your body be stronger. 15. Celiac disease symptoms can be completely different among family members. Yes, I hear it all the time. People will say, well, I don't have diarrhea every day, or I don't have that rash that you do, or I don't have a seizure disorder. Everybody can present differently. We're all our own unique individual human beings, and we're all our own experiment. But those symptoms that we present with can be very, very different, even among family members. So do keep that in mind. 16. Celiac disease symptoms number over 300 are widely varied in nature, affecting every and any body system and organ. The 300 symptoms list was first presented in Recognizing Celiac Disease, authored by Cleo Libinati, RN BSN, and published in glutenfreeworks.com in 2007. Again, I have at least 4 copies of this in my office because when I first started Gluten Free RN way back in 2007, that was a very valuable resource. 17. Symptoms in celiac disease are due to inflammation and or nutrient deficiencies from chronic intestinal damage. Yes. So all those symptoms, which are body-wide and system-wide, are due to inflammation and or nutrient deficiencies from chronic intestinal damage. So our goal is to heal up that intestinal damage, get rid of the inflammation, heal our immune system, and replete all of those nutritional deficiencies. And that takes time, energy, and some money to fix some of these things. Food is our medicine, so we have to spend our money on the best food possible so that our bodies can get better faster. 18. Celiac disease diagnosis can take 10 years or more from the time first symptoms present. It is frequently the last disease doctors consider. Unfortunately, that's very true unless you live in a country that has universal health care. And hopefully at that point, the doctors are actively looking for celiac disease because they know that you cost the government less money the sooner you are diagnosed. Unfortunately, those of us that live in the United States live in a for-profit healthcare society. I'm working to change that also, but right now, there's no impetus for the doctors to test early for celiac disease. And unfortunately, many of the nurses and other colleagues that I work with have heard doctors say, why would I look for it or diagnose it? There's no money in it for me. So if that's the overwhelming attitude of some of the practitioners, no wonder. I've been working on this for 10 years and we're making progress, but it is slower than I'd ever imagined. 19. Celiac disease affects over 3 million people in the United States, yet the vast majority are not diagnosed. The symptoms of celiac disease are frequently considered the definitive diagnosis, leaving the true underlying cause untreated. So a lot of people are getting treated for those symptoms very superficially, but the underlying cause is typically celiac disease. And that can be anything from MS to any other autoimmune disease, ALS, type 1 diabetes, lupus, Sjogren's, anemia, osteoporosis, failure to thrive, eating disorders. So we really do have to dig deeper and find the true underlying cause. 20. Exposure to gluten is the most important environmental factor in celiac disease. The sooner gluten is removed from the diet, the more likely full remission will be achieved and long-term complications can be avoided. The interesting thing about celiac disease is if you don't eat grains, if you don't eat gluten, then you're never going to develop celiac disease. So, epigenetically, if you do not expose your genes, even if you're predisposed for celiac disease, to gluten, then you will never develop celiac disease. So, parents sometimes will ask me, when should I start feeding my baby gluten? Ideally, my response would be never. If you know that your child is predisposed genetically to celiac disease, ideally, you will never expose that child to gluten. This is not an allergen. This is an autoimmune issue. So you need to take that into account. And finally, 21. Although celiac disease is now known to cause over 300 symptoms, the medical community has traditionally instructed doctors that celiac disease affects children with presenting symptoms of diarrhea, wasting muscles, anemia, and abdominal distension or bloating. You must request celiac disease testing if you do not fit this list, and often, even if you do, assuming doctors look for celiac disease is a mistake. Once again, you have to be your own advocate, or sometimes people have to pay an advocate. I myself am a medical advocate for my patients and my clients. Find somebody that will speak, that is vocal, that if your practitioner is not doing the testing, the appropriate testing for celiac disease, that you need to perhaps find a new practitioner. Advocate for yourself, your friends, and your family. I hope you found this useful. I refer to this list all of the time, so I thought it would be useful for you to hear it and have it as a reference so that you can refer to it also. I'd like to thank Cleo Libinati for writing Recognizing Celiac Disease way back in 2007, and also her son John Libinati for continuing to update us all on glutenfreeworks.com. There's very valuable information on that website, and I would direct you there if you're interested in doing more research. Thank you once again for joining me. This has been episode 33 of the Gluten Free RN. I'm Nadine Gruskowiak, the Gluten Free RN, and I wish you all the best in your health and happiness. Thanks for joining me once again for episode 33, 21 important celiac disease facts you need to know. Until next time, bye.